Welcome back. This is Dr. Jin Sung, and today we're going to talk about nutritional deficiencies and fatigue. Before I get started, my name is Dr. Jin Sung. We are located here in the Merrimack Valley, close to the New Hampshire border, about 30 minutes north of Boston. We put out a lot of good information. What I'd like you to do is share it with your family and friends so they can get quality information about their health and alternatives to medications that patients are on. So if we look at nutritional deficiencies, why would, in the land of abundance, here in the United States, why would patients have nutritional deficiencies? Okay? Maybe it's not just the nutrients, but maybe it's their physiology that do not allow them to absorb their nutrients. Okay? So I'm going to go over maybe 7 different things in terms of causes for nutritional deficiencies. So number 1, in the American diet, we are taking in a lot of fortified foods, right? Enriched foods, enriched flour, enriched packaged products, and so forth. They're just trying to hit that minimum requirement, the allowed daily allowance, right? That's what they're trying to hit. However, what they use is cheap supplementation, cheap vitamins, right? Things that do not absorb very well in your GI tract. So they're using cheap things to fortify foods. And that can lead to some nutritional deficiencies because your body can't absorb it or they can't utilize it for proper function. So fortified foods is not necessarily the best thing to do. You need to have whole, fresh foods. Foods that you cook. It's very important that you do that, okay? Number 2 is the incorrect forms of nutrients, right? So it might be fortified with some B vitamins, but calcium, but they might use cheap forms of calcium like calcium carbonate rather than some of the more expensive forms of calcium. If you took one of those most popular multivitamin, everyone knows it. I don't want to name it, but there is a multivitamin. It's what is the #1 seller, right? It's in pretty much any drugstore or Walmart or wherever it is, right? If you take it and you go like this with it, it sounds heavy. It's like kung, 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 kung. It's a heavy supplement bottle. And the reason it's heavy is because it's fortified with cheap calcium. Things are, it weighs a lot, but it doesn't absorb very well. So those 1-a-day vitamins that people take, and the multivitamins, it doesn't have the proper nutrients. It really doesn't. It's basically, you're wasting money, right? You take it in, you pee it out, or you excrete it out, and that's it. It doesn't get utilized properly, right? So incorrect forms of nutrients is an important factor for nutrient deficiency and fatigue. The other thing is the use of antacids or medications. People who take long periods of antacids, you know the names, right? The Prilosec, Zantac, these long-term use of antacids can lead to nutrient deficiencies. And the reason is, if you lower your stomach acid, right, to reduce reflux signs, if you reduce the acid, you're not going to break down your proteins, carbohydrates, and fats. So you need an acidic environment in the GI or in the stomach to break down your proteins, fats, and carbohydrates appropriately. Without it, you're not going to absorb it. So therefore, long-term use of antacids can lead to nutrient deficiencies, especially B12, iron, right? So you're not absorbing nutrients. That's a big factor, right? It's not that you're not eating properly. Your antacids are knocking down the absorption. So it's very important for patients to be aware of that. These antacids are not meant to be used year after year after year, right? I think there are some case studies and some reports coming out regarding use of antacids and leading to things like Alzheimer's or dementia because of long-term malnutrition or nutrient deficiencies. The other thing is, if you have reflux signs, you have to ask yourself why, right? So one of the leading causes for reflux can be something called H. pylori, Helicobacter pylori. So if you have a gut infection called H. pylori in your stomach, that will decrease the acidity of your stomach, and it's an infection. So therefore, it can suck up your nutrients. Iron deficiency is pretty common with H. pylori infections. So if you have reflux signs, you should call your doctor or ask your doctor to be checked for H. pylori. And the way they check it is they use a breath test. They make you drink a solution, you wait a little bit, and you breathe into a bag, and they look to capture a gas that is produced by H. pylori. The other way you can check for H. pylori is through the stool, where you can look for antigens in the stool sample. So there's different ways to check for H. pylori. Another way is to check for blood, right? You can check to see if antibodies in the blood. The most accurate way really is either the breath test or the stool test. The other reason, number 5, is really SIBO, or small intestinal bowel overgrowth, and IBS. So SIBO can also lead to malabsorption. So the SIBO is basically bacteria that's in your large intestine, closer to your colon, sneaks into the small intestine and creates a lot of bloating, gas, distension, burping, those types of things. These patients, they go, Dr. Sung, in the morning I feel okay, I have breakfast and I start to bloat. By dinner time, I'm looking like I'm 4 months pregnant or 5 months pregnant. The belly is out to here. They can't zip up their pants or button up their pants properly because they have so much bloating. So if you have bloating, you may consider that you may have something called SIBO, right? And that in turn will create nutritional deficiencies. So if you have a lot of bloating, you want to ask your doctor to be checked for SIBO, or small intestinal bowel overgrowth. That is another breath test. You have to drink a solution, they can check for gas, and the 2 gases they check for are methane and hydrogen. Okay? If you have methane, it can create constipation. If you have hydrogen, it can cause diarrhea, right? So when you have alternating constipation, diarrhea, you may have both gases. Or if you're constantly running to the bathroom, they might call it IBS, right? But in reality, it could be SIBO, or small intestinal bowel overgrowth. It's really an important test to do if you have a lot of bloating and distension. The other one would be leaky gut. Now, leaky gut is something called intestinal permeability, where basically the gut lining has to be very, very tight, right? It has to break down the food in the lumen of the small intestine and then has to be absorbed through the lining. But if the lining, it should be very, very tight, what can happen is with the use of, antacids, drinking soda, smoking, excessive medication, whatever it is, it can start damaging the junctions. The junctions are called zonulin and occludin bonds, and it starts to break apart. And then food particles will leak into the bloodstream. Large food particles, larger protein, larger amino acid sequences. So things that should not be in the blood will start to sneak into the bloodstream. So if you get this junction where it's breaking apart, that is what they call leaky gut or intestinal permeability, right? So you have to be able to seal the gut, make it tight, break down the foods, and only micronutrients really should get through, right? Small components of proteins should get through for utilization. So if you have issues with malabsorption, you have to look towards the gut, right? You have to look at reflux problems, antacid use, small intestinal bowel overgrowth, leaky gut syndrome, or intestinal permeability. You have to look at those types of things. The other thing is food quality has dropped over the years, right? The soil is being depleted. They don't farm like they used to in the old days. They use just a lot of herbicides and pesticides and chemicals to enhance the yield. But in reality, the soil is being depleted of its nutrients, right? Its micronutrients. And it's full of herbicides and pesticides. So whenever possible, visit the farmer's market, go to the local farms, where you know they have good practices, where they rotate the soil and give it good nutrients rather than just herbicides and pesticides and so forth. So farmers markets, local farming, those are important things, right? Or whenever possible, try to go organic. Just being organic is not always, the best thing because of other things that they use, but it's better than your traditional conventional grown. So it's important so not to get that soil depletion, right? So those are the components, right? Fortified foods that are being fortified incorrectly, incorrect forms of nutrients, antacid use, they're using it for too long, reflux problems related to infection like H. pylori, SIBO, or small intestinal bowel overgrowth, where bacteria from your large intestine sneak up into the small intestine, leaky gut syndrome or intestinal permeability, and then soil depletion. And there are other people who have infection, not just H. pylori infections. We often find people who have protozoan infections, larger worm infections. These people also can be nutrient deficient also. So it's very important to look at medications, look at the food quality, look at where the underlying issues might come. And there are a vast array of nutritional companies that make up these, what they call gut healing protocols, right? It comes in like containers and it has all the nutrients that are good for gut healing. So you might want to take one of those, right? The companies that are very good are things like Designs for Health, Metagenics, Apex Energetics. There are a variety of them, right? But don't go to your local CVS or one of the drugstores and just take a supplement. Oh, this is great. It's $5 for 1,000 pills. You know you're not getting a good quality nutrient supplement, right? So it's very important for you to seek out and educate yourself about these things, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. We'll see you back next Tuesday on the healthy side. Take care.